We're going to begin this morning with morning rounds and a discussion of today's subject, maintenance of certification. I'd like to begin with a moment of silence for all who are in need. And then a reflection that we all may be mindful to do unto others as we would have done unto ourselves. And I just have to say, God bless America. As I prepared for our presentation yesterday, a question stood out for me. And actually, it's been a question that's prevailed since we all began this project. And that is, why do we not see more physicians engaging in not only this particular activity, but others that will lead to change in our present circumstances? As I watched presentations yesterday, I was really struck by something that stood out to me. And that was the people who had taken action and created the presentations that we will watch today were doing nothing more than engaging in their daily practice, and in particular, being compliant and doing what they knew was expected of them. And rather than letting that question just travel through their minds, the people that we're going to listen to today actually let that question stop in their mind, and they asked themselves, what am I doing? And then they responded with an answer to that. And then they asked themselves, why am I doing this? And began to answer that question for themselves. And once again, the next step they took, very interesting to me, is they began to ask themselves whether what they were doing, why they were doing it, and the answers that they had come up for themselves were valid. Then they went on to gather information that led to them becoming more knowledgeable and taking steps. I think that those observations may help us have better insight into the difference between physicians who stop and take action, and then those of us who get on with our daily gristmill, doing the things that we know we need to do, understanding that we have multiple external influences guiding our daily decisions. So again, as I prepared for today's presentation and watched some of the presentations, this question came up: what am I doing, and why am I doing that? And I believe that when you were sitting down doing what was expected of you, that question came up in your mind.
It did. Do you want me to share a little bit about
do. Yeah.
that? So what Dr. Thompson is referring to about why I wrote this op-ed I did called the Doctor's Declaration of Independence in April 2014. And I guess for me, it was this recognition and realization at one moment in time that when I was dictating all these charts at the end of dinner, and our family had just finished dinner, and here I was, you know, from 8 o'clock to 10 o'clock at night, trying to catch up because we were using an electronic health record, and it had slowed us down, and my workload had increased. And the thought just crossed my mind, this is absolutely ludicrous and crazy. Why am I doing this? What happened here? Because it certainly wasn't the way I used to practice. And it was the recognition, I think, and the passion, the realization that what had changed is that there were people outside of medicine who had come up with legislation and mandates that had forced me to use an electronic health record, that had slowed down my efficiency and productivity, and here I was having to spend more of my personal time away from my family, just to keep up. And I just kind of came up with the decision or said, you know, it's just not right, and I need to speak out about it. So for me, that's kind of what led that. Now, I could have very easily said, you know, gosh darn it, Dan, you got 2 hours of work, just do it. and roll over and get it done and go on to the next day, right?
Correct.
I've done that in my life, in some experiences in the past. And I think all of us physicians do that sometimes. But this was different because this felt that this was an injustice. Now, there are public and maybe other people would look, what are you talking about? What do you mean? Well, it truly was an injustice. That's what I felt, and that's what I believe, and I believe that to this day.
Well, in my own case, I had had a great private practice, really enjoyed it, but just couldn't make it work with the financial and regulatory situation, so I closed it, went to the VA hospital. And there I first encountered what they call clinical reminders, but I believe are part of the meaningful use program, that were a big distraction and problem, and I fought that for about a year unsuccessfully, and then moved on to another employed position, found the same sort of thing, and moved to a third and found the same thing. In all three cases, basically the chief medical assistant would come around, having been instructed and sent by the administration, to tell the doctors how we would practice, how long we would see each patient, how we would document, which boxes we would click. And at that point, about the third position, I stopped and said, wait a minute, what is going on here?
Right.
And so that was my aha moment, and where I stepped back and just tried to put my skills as a diagnostician to work here. What is causing this problem so widespread?
So, I find it very interesting, namely because we've asked ourselves time and time again, how do we engage physicians, and why do physicians not engage? And then, as I said, I asked myself, what's the difference between physicians who did engage, who have taken action, and those who are just continuing to stay on the gristmill? And my observation is that that question came across their mind, as I believe it has for all of us, and rather than letting it pass through, they stop and they grab the question. What is going on here? Why am I doing this? Is it valid? And is there value? And I believe as they began to actually take the steps to gather information to validate or determine for themselves whether or not there was value to what they were doing, it led them to take action. And we're going to see actions taken this morning by Dr. Cavalli and Dr. Tierstein, who are both now national leaders. As we wrap things up later today, we'll have a list of actionable items that all of us can take beginning today, so that we know that we're contributing to what we're doing. It was really impressive to me that as these individuals began to gather information to determine the validity of the conclusions that they had come to, they became informed in what they were talking about. And we are all going to be encouraged by these speakers today to become well informed about the topics that we're dealing with. And as they became informed, we have a dictum, knowledge is power. And at least my observation watching these speakers speak, I believe that I perceived powerful individuals, people who believed without a doubt that they were masters of the knowledge that they'll be presenting to us today. And so I want to do like Dr. Kuracek did at our initial presentation on Monday morning, and that is, remind all of us that we passed the SMART test, and we even passed the jump through the hoop test. And now we're being asked to tolerate the intolerable. And we're even well trained to do that. But it is time for us all to develop the courage to raise a question. Not long ago I would have said to have the courage to just say no. But maybe the courage to recognize the question, and then define the question, gather information, and ask yourself, is the answer to the question valid? And if so, what information do we have to validate the question? And then maybe begin to carry that forward with some of the other national leaders or yourself or however you might want to do it and move this effort forward.
Yeah, and then I think another part of that was that, especially with Dr. Terstein, recognizing the problem. And then I think the next step you have to ask yourself is what I'm perceiving, is that reality?
Correct.
So he asked that. And then the next step has to be, is there a majority of physicians who feel the same way I'm feeling?
Right.
And then the next progression is he sends it out there. And then the next step is there consensus in what I believe? Do a majority of physicians really, truly feel that way? And if they do, then he was able to come up with a change.org document, had a lot of signatures on it, and then you have something objective, real, that, yes, I was right. This is a majority of physicians feel this way. And not only that, they are now willing to sign their name on a document that say they feel this way. Then that's when action occurs, right?
Yeah.
I think you need each and every one of those steps. And he was able to do that, in particular with maintenance of certification.
Right.
I hope we can do that with electronic health records, as we talked about 2 days ago, and some of these other issues that I think a majority of physicians feel really have an impact on them. But to date, but for the maintenance of certification, they have not yet spoken up.
Physicians have not yet spoken
Yeah,
up.
in a powerful way, like
Yeah.
maintenance of certification
Yeah.
I think it's occurring, but that's what you need.
Is the consensus.
Is the consensus, and then
Yeah.
and then take the step, sign the document, and let your name, put your name on it. I mean, if you believe in that, if you feel to the core, if you feel in your heart that, yeah, they're right, then darn it, take a risk, take a little step, put your name on something so that the American public and our patients and our elected officials know this is a huge thing. This is affecting this profession in a way we didn't realize.
Right. And I want to let our audience know that Dr. Terstein has a petition, as you mentioned, and we're trying to get the link for that to put it on our site so that people can find it easily. At last count, as far as I knew, over 23,000 people had signed.
So we're going to talk today, or else we're going to listen to speakers today talk about maintenance of certification. Do either of you have personal experiences that you can recount?
Yeah, I do. Again, I'm an orthopedic surgeon. I was originally board certified in 1993, so I've done maintenance of certification twice now. The last one a couple of years ago. It took a lot of time, and you know, you need so many units of continuing medical education, which is fine, and I do that anyway, just as a you know, conscientious physician that I think I am. I go to those courses anyway, but this was even more than that, so it took a lot of time. I went to a course because I wanted to make sure, you know, I increase my chance of passing, right? So
You're talking about testing.
yes.
Yeah.
So then this is the recertification,
right, yeah.
and maintenance of certification, which you have to do. So it's a lot of time, and as Dr. Terstein will share with us, I don't think there's any credible objective evidence that shows that just because you go through a maintenance of certification process, that you're in any way more qualified than if a physician didn't go through that process.
Correct.
So it's lengthy, it's cumbersome, and he makes a very, very valid case and strong case that is there any objective evidence in doing this? And you'll hear that in his presentation today.
I think an important point to be considered with regard to the time that is necessary to be compliant with the maintenance of certification requirements. And I have to specify, I'm a general surgeon, and I think it's a bit different for the surgical specialties than it is for the medical specialties. There is time necessary to sit down and work through the modules that are required to meet the criteria for certification. And the time that is taken to complete those modules is time that's taken away from patients. So that limits access to care for patients.
Yeah,
How about you, Michael? Any comment on your personal experience?
Well, I took the tests in 2005 and became board certified in internal medicine. And that at the time was good for 10 years, so that's due this year. I've not gone through these other modules and this continuous MOC that's causing all this controversy now, although I think my wife, who's an oncologist, did get into some of that when she certified. I feel like physicians are self-motivated. Most of us really want to keep up. We want to learn and be as on top of things as we can possibly be, for many reasons. And I feel like we would be doing that anyway, most of us. Mm-hmm. So if I weren't being beaten by a stick with someone with their hand in my pocket to the tune of thousands of dollars a year, I really think I would do more to keep up with that. Mm-hmm. There's another obstacle, and that is a lot of the medical literature is hidden behind paywalls, where it may cost anywhere from $10 to $50 to get access to each article. And I think patients should realize that your doctor can't be up to date if there's that kind of barrier, because you can't spend that kind of money to read and keep up with multiple articles. So I'd like to see those barriers removed. If we had good access to the medical literature at a reasonable price, and people would just give us, again, some breathing space to do what we want to do anyway, I think we would have a better educated and up-to-date profession.
Would you take a minute and just plug Dr. Gibson and WikiDocs, who presented to us on Monday with access to medical information?
Sure. Michael Gibson, I believe of Harvard, is the founder and CEO of wikidoc.org. And there are many physicians collaborating on this to edit and keep it up to date. It's basically an online medical textbook, a living textbook. And it's written at the professional level of physicians. They have a sister organization, wikipatient.org, where the material is written to the patient level. So I would encourage everyone to look into those sites.
But even then, Dr. Gibson did tell us that some of those essential references were going to be behind paywalls, and those barriers had not yet been effectively addressed.
Right. So if you read an article there on Wikidoc, there will be references you can go to. Some of them might be full text, some of them may be just abstracts. He did say there were some recent changes that make sure that some of the taxpayer-funded research is not allowed to be put behind a paywall.
So if I may just take an opportunity to plug my national organization, and I'm doing this strictly from a personal point of view. I'm a member of the American College of Surgeons and the American Society of Breast Surgeons. And that society has really made a laudable effort to make information available to us. Sure enough, there are modules, and I can seek information through those modules through the society website. I can complete those. I'll get my CME. That CME is applicable toward maintenance of certification, and also, by the time I get to the point where I have to retest, if I've been keeping up, it's pretty much all right there for me. So I would say check with your national organization and see if they have done the same and made information available to you. Some of it may be what you're looking for, some of it not, but the point being that there are organizations out there who are aware of what is being expected of us and are taking steps to help us to be compliant. But the question is compliance necessary? Is it valid? And that's the question that Dr. Cavalli and Dr. Tierstein will raise. We'll also hear today from Mr. Kurt Eichenwald from Newsweek, who has been active in helping to spread information about the actions of the American Board of Internal Medicine and I'm not clear personally on the relationship between the American Board of Internal Medicine and the American Board of Medical Specialists. Can either one of you speak to that?
I believe the latter is the umbrella organization for
Correct.
the multiple other specialty organizations.
Correct.
So Mr. Eichenwald will be here with us today if you have any questions for him. And again, we'll get to speak personally with Dr. Tierstein, Dr. Cavalli.
Could I just say something there?
Yes.
Kurt Eichenwald's series on the ABIM and maintenance certification was really interesting, and I'm not fully informed, so I want to hear from him and Dr. Tierstein. But you know, the impression I got was that some of the executives of the ABIM may have awarded themselves multi-million-dollar salaries. There was a mention of a $2.3 million condo that was purchased for the organization. Meanwhile, the physicians that they are requiring several $1,000s per year each from for continuous maintenance of certification are making much, much less than that. So I believe that most physicians want to be as up-to-date as possible and as well-informed as possible. But if the ABIM or any other organization is going to be certifying us, then they need to be one of us, right? They need to be practicing physicians. We want them to be at the top of their game. And those are the kind of people we want to write these rules and this testing that makes sure we're up to date. Now, again, I don't know all the details, and I'll wait to hear from the experts, but if people who are not practicing at least full-time, who are making much more than the people they are certifying and are not seeing as many patients or being as involved in the clinical side of things, that should not be the system that is designing these testing and evaluations.
And can I share one other thing?
Sure.
The other thing is that, you know, we can have an honest discussion of maintenance of certification as physicians, and we should. And there might be people on both sides who disagree. And there might be some of us who would say, yeah, I think the maintenance of certification process is a valid tool to gauge physician competency in your specialty. But my question to the American Board of Internal Medicine and all the other ones, if that is your view, if you take that view, then why in the world would you ever grandfather certain physicians in above a certain age? In other words, if you're a physician and you're above a certain age, a lot of these board specialties grandfather them in. They said you don't have to go through a maintenance of certification process because you're over a certain age. Well, why not? You just told us that we need that tool to gauge physician competency. So why shouldn't every physician, if that's your case, you tell me why shouldn't every physician go through that maintenance of certification process? And that is, to me, hypocrisy, is what I would say.
Yeah, so of course that's one of the issues, not directly the grandfathering, but the hypocrisy that comes forth. A question that will be raised in one of the presentations today is, does certification and expertise, does certification validate a person's expertise? And do we have information available which will validate a person's expertise? And I think that we have a growing body of evidence that we can use, and in fact will be used in the future, in particular by CMS, to determine degrees of reimbursement by physicians. You know, I'm just wondering if a person has already met certain criteria and proved competency in their field of specialty, why should they have to double back, pay fees, take times, jump through hoops to meet somebody else's definition that may really have nothing to do with what we're doing?
And the concern that, so we were all received our certification when we received our boards once, right?
Correct.
And then each of our state medical societies require that we have to, they require certain number of continuing medical education units every year. So some physicians say, that's enough.
Yes.
Why should you go through another recertification? On top of that, I think most physicians, as Dr. Strickland alluded to, keep up. I read my Journal of Bone and Joint Surgery. I go to continuing education courses in orthopedic surgery. I prepare for my surgeries beforehand. So, and then the further problem is, now that this has become kind of accepted, maintenance of certification, then our hospitals are using it as a requirement for staff privileges. And now it becomes even more onerous.
Yes.
Staff privileges. So I, as a physician, might say, you know, I don't want to go through the recertification process, but now I have to, because now my hospital says that has become the standard, and Dr. Craviotto, you cannot have staff privileges here at this hospital, because that is what your own societies are saying. So we've gotten ourselves in a huge mess, if you ask me.
Yeah, and as we all know, maybe we just follow the dollar. And I wonder what we might learn if we were to follow the dollar. But I'll leave that, put that aside. One of the other issues that comes up as we go through maintenance of certification and retesting, I have gone through retesting, and you guys may recall, suddenly you find yourself studying and reviewing subjects that don't pertain to your practice of medicine. And so, for example, I find myself restudying the nuances of vascular surgery. I am not a vascular surgeon. I am not going to perform vascular surgery. It is time consuming for me to review all that information, commit it to memory, go and take the test, you know, essentially jumping through the hoop. Once I'm done taking the test, I'm not going to use that information again. I would be completely foolish to even try to use it. I would seek consultation through somebody who's properly educated. So once again, those things are going to come up in conversation today. Audience, we really need to hear from you guys. You're going to be encouraged, especially by Dr. Cavalli, to become your own advocate, the advocate of your patient, to align yourselves together with your patients and with your peers, with your community. Start where you are, do what you can. And I ask you, go ahead.
No, go ahead.
That when a question crosses your mind, wondering about the validity of what we're doing, let that question stop. And then go the next step and ask yourself, what is the answer to the question? And then ask yourself, is the answer valid? And is there information to validate that? That's a lot of work, but if we each do it individually, we'll be gathering knowledge. Knowledge is power. Go ahead, Michael.
Thanks. I also wanted to invite the leaders of the ABIM and the other organizations that are responsible for MOC to call us and weigh in. We'd love to hear from you. Dr. Rich Barron, head of ABIM, and the other leaders and proponents. Please feel free to weigh in and let us know your side of the story.